your paperwork, it looks like we have you here today because you've been having some floaters in your vision. Okay. Can you describe them for me? For example, are they like black spots, flashes? Are they little like clear blobs? Okay. Did they come on suddenly or gradually over time? Okay. Are they focused more in one eye than the other? Okay. And are they making it hard to see at all? Any sudden increase in blurry vision, difficulty focusing your eyes? Okay. Any other visual changes? How about headaches or eye strain? Do you get ocular migraines? And any history of diabetes? Okay. How about elevated blood pressure? And how would you say your stress level is? Can relate, yes. Really quickly, I have my vision chart right here. Whichever line you're able to see the most comfortably, can you read it for me? Okay. Are you able to read any of the letters on this line? Go ahead and try. Good job. How about this line? That's okay. These two bars here, do they look like they're the same color to you or different? Can you tell me what color this one is? And how about that one? Okay, good. I would say her vision is actually 2015. Alright. So then, I have this Penlight here, okay? And I have it actually in a protective case. Not that it's going to make contact with you, but we like to keep things sanitary here. So, if you can just try to keep your eyes open as best as you can, focus right here, right in between my eyebrows. And then without moving her head at all, I'm going to move my light. I'd just like you to track it for me, just using your eyes. Good. And again, focusing in between my eyebrows. Tell me when you see my light. And tell me when you stop seeing my light. Good. Same thing on the side. Tell me when you stop seeing it. and tell me when you see it again. Still staring in between my eyes. Is my light brighter here or there? Okay. Here or here? And here, here. Good job. So now this ruler here, it's okay if you can't see the increments on it. We're going to examine your depth perception. So I'd like you to tell me, is point A here closer to you than point B? How about point A, point B? Point A, point B? Now I'm going to hold it to the side. Is point A closer to my pinky than point B? How about point A, point B, point A, point B? Good. Going to blow a couple puffs of air into each of your eyes, and this is just going to test for glaucoma. So try to keep your eyes open as best as you can. Okay. And the other eye. That's nobody's favorite. There's going to be a bit of a series here of different lights and things in your eyes. This is going to give me the opportunity to look at the vessels within. So do your best to keep your eyes open. If you need to blink, it's okay. Don't want you to feel pressured like you can't blink at all. I'm gonna look at the other eye. Right. I'm able to take a look at your eyes from the periphery, so it's going to be just shining in your eyes from this side. Just looking for anything on the surface of the eye or about the shape that might be noteworthy. Take a look at the other side now. So, not seeing anything concerning, no adhesions or abnormality to the curvature. And your red reflexes are intact bilaterally. Which is good. So now I have another light I'm going to be shining in your eyes. And this one, I'll show you. So you can probably see on my palm that there is a bar of light, and I can rotate it. I can also make it wider or thinner. So what I'm going to do is I'm going to be lining this up in your eyes, and this helps me determine if there's potential astigmatism that we need to investigate. Okay, so that vision chart over my shoulder, I'd just like you to do your best to gaze directly at it and try to make this quick, because I know it can be a little bit uncomfortable. Keep focusing on my chart. Okay. I'm gonna switch sides. Using this side, gaze again at my chart. Okay. Give you a break from the lights for a few moments. to do is I'm going to palpate around your eyes, just feeling for any kind of infraorbital inflammation, the presence of any lymph nodes, or any kind of asymmetries or bony abnormalities that may cause visual changes later on. So, to start, I'm just looking. And is it okay with you if I touch you? Thank you. Okay. And just starting by just looking at your eyes. Can I have you close your eyes for just a moment? Okay, you can open. Not seeing anything concerning there. So, okay. If it's okay with you, I would like to dilate you. However, that does mean that for a couple of hours your eyes are going to be a bit blurry, a bit more nearsighted. That being said, reading like on your phone might be a bit difficult, and you will be a bit light sensitive. However, we do have some sunglasses that we can provide you with to help and protect your eyes. Is that okay? Okay, good. It'll really help me to be able to see more clearly and more in depth of what may be occurring that's causing these floaters in your vision. Along with dilating you, I also have a contrast drop. As you can see, they're yellow and they're going to make your vision a bit yellow for a while, but that's also going to help me see what is causing the floaters and also help and determine what would be the best course of treatment depending on what we discover. Okay? So, and I'm going to go ahead and administer the drops now. And before I do that, I'm actually going to turn off the lights. So, pardon my reach here behind you. One more over here. Alright. So then if it's okay with you, I'm just going to tip your head back. Just like so. Alright. Let's try to hold that. I'll be quick. I don't know if some people have sensitive necks. I do. Alright. Put a drop. You ready? Okay. Good job. So that's the dilating drops. So it's going to take just a few minutes for the dilation to kick in. Your vision should already be yellow, yeah? Okay. So I'm just going to write a few notes while we wait for that. So... Okay. And actually, I can take these gloves off. So, let's take a look at you. Oh yeah, you're quite dilated. Let's just do something really quick. So now I'm going to move my lamp over here, okay? So let me just reposition some things. Okay. So I'm just going to position this like so. If you actually tilt your head just slightly. Perfect. Okay. So now just position. Maybe put your chin right here on the chin rest, okay? Alright. Just going to kind of position this light here. Alright. Okay. using my Penlight here, and it's going to get kind of close, so like here. Alright? Do your best to keep your eyes open, even if the light is a bit bright. You did great. So I'm going to get this out of your face here now. So pull that back just a little. Okay, you can sit up. Okay, just gonna dab some of these little yellow tears here. So I did see some changes in the vitreous humors of both eyes bilaterally that do indicate that you would be a good candidate for something called Vitreolysis, which is where we would be using a laser to break up the little floaters in your vision and help you see more clearly. It is relatively painless. The procedure is painless. Afterwards, you may experience some burning, kind of like a dry eye sensation, as well as some light sensitivity and a little bit of blurred vision. There is often some redness, like kind of a bloodshot appearance to the eyes. And you may see some dark spots in your vision, which is normal. It can bring some little bubbles of air to the surface, which is what that is, and they do go away after a few days. Risks include a little bit of bruising, and worst case, very rarely happens, some damage to the retina. I have never had this occur, and I have performed hundreds. It is an outpatient procedure, and you are safe to drive home. We will provide you with sunglasses to help and protect your eyes from any kind of light or discomfort. And I would be prescribing you with some eye drops to use to help your eyes feel more comfortable, as well as protect against any kind of infection. And I would have you come back to the clinic to reassess you in 3 days. Is that something that you'd like to do? Yeah, the procedure itself is painless. You might feel some warmth, maybe kind of like a tickly, itching sensation, but it shouldn't hurt. Okay, yeah. So then, just a moment, let me just try it out. So then I just need you to sign right here for me. Perfect. Okay. So I'm gonna put this shield up right here. It's gonna go right over your nose and mouth here. Okay. Is that okay? It's pretty lightweight. It shouldn't be irritating. And then this out. Tuck your hair behind your ears. Alright. So now you're going to want to do your best to try and keep your eyes open. It's not a problem if your eyes close or if you blink. Just okay. You ready? Alright. So it just sort of flashes on and off. A little bit of watery eye shouldn't take too much longer. Right. I'm just going to give you some eye drops that are going to help and soothe your eyes, make them feel a bit more comfortable, okay? Just going to tilt your head back. Start to feel a bit more comfortable. Alright, so then how are we feeling? How are we feeling in terms of light sensitivity? Would you like me to give you your sunglasses right now? We can do that, absolutely. So, okay, they're not the most stylish in the world, but their purpose is function, not fashion. Sorry. Alright. So now, I'm going to write you a prescription for some eye drops. These have an antibiotic in them as well as just some soothing properties. And you're going to want to use these twice a day, in the morning and in the evening. I do recommend taking extra precautions to protect your eyes from light, sunlight, but also indoor light if needed. If you start feeling like your eyes are straining, put some sunglasses on, even if it's inside, okay? And just take extra care in terms of screen time, whether it's your computer, phone, or even watching TV. If you have the option to use night mode, I strongly encourage it, okay? And let's see, okay, so I have here CVS on 17th, is that correct? Okay. And check your allergies. Doesn't say you have any. That's accurate? Okay, good. Just gotta check. So, okay. Generic is fine. So I'm going to have an assistant call this in for you as soon as I step out of here. I would also like you to return to clinic in 3 days, and I will make sure that my front desk has you as a priority patient, so they will fit you in or move around my schedule as need be. So, like I said, some dark spots in your vision, that's okay. Redness, some soreness, light sensitivity, even a little bit of bruising and swelling, that's also okay. If you wake up with a black eye, that's a different story. I want you to call me immediately. Same if you start experiencing severe swelling. If you start looking like you should be living in the swamps of Dagobah, give me a call, okay? If it's after hours, have me paged. I will call you back immediately. Same as, like I said, some dark spots, that's okay. But if you're starting to get big dark spots, call me immediately. I want to see you right away. If I'm not available, one of my colleagues will fit you in. But I'll be available, don't worry. I just want you to know that all of your bases are covered. We will take care of you, okay? And same goes for if anything just feels off, just doesn't feel right, give us a call. Because sometimes it may not be anything specific, or even anxiety can kick in, and we want to address that too. So call me no matter what. If it doesn't feel right, give me a call. But in the meantime, I will see you back here in 3 days. So before I step out, do you have any questions? Okay. Well, if you think of anything, like I said, give me a call. Okay. Well, it was really nice to meet you, and I'll see you in 3 days.